As you can imagine, we feel very passionately about the work that we do, so it's always a pleasure and an honor for us to be able to share it with other people. So we're pleased that you could be here. We're actually going to be talking about work that we've been trying to accomplish at Portland State with our community partners over a number of years, and we'll try to focus on these areas that we think you might have greatest interest in, how we actually try to do that as effectively as we can. The title of our panel today is The Search for Social Sustainability Through Promotion of Environmental Health Equity, a case study of University Community Partnership in Portland, Oregon. Our panelists have already been introduced, our colleagues Eileen Brennan, myself, Ben Duncan, Leroy Patton, and Noel Wiggins. And let me jump right into what the project is. At Portland State, a number of us had been working with our community partners as well, mostly on the area of social sustainability. And it became very apparent to us very early on that health equity was one of the underlying issues, problem areas that we needed to focus more on and figure out how closely related social sustainability was to environmental health. And over time, we developed our understanding and refined our understanding about environmental health and social equity. As you would well know, most of you who are here and who would be from Portland, Portland is recognized as a leader in urban sustainability. We are well known for being innovative in local governance, progressive urban planning, transportation, and green infrastructure. We are also known as a very livable city, very attractive, but what we do know, for those of us who have done the research, and as we would increasingly find out in our partnership, is that there are substantial inequities that continue to exist in the city. And these inequities are evidenced with a disproportionate burden being borne by low-income communities and communities of color. And we're not unique by any stretch of the imagination in the United States, for example, for having that pattern of inequities, but in some ways it's not what we typically think of when we think of Portland. And so in some ways our work is even more difficult because it's not what we typically think of as what occurs in Portland. The data here might be difficult to see, so I'll just point out some of the key elements of it. It's tracking economic data, health data, and comparing Portland to two other major cities on the West Coast, Seattle, Washington, and San Francisco. And in the first area here, what we look at is median household income in 2010. The first column shows Portland, the second one Seattle, and the third one San Francisco. The second number, so you can see what housing values are. The second row here, it shows people of all ages in poverty between 2005 and 2009. So Portland is about 16%, in Seattle 12%, and San Francisco 11.5%. So we do have the highest levels of poverty in terms of households. When we look at health, and this is looking at 3 counties from the 3 states, the first one, Multnomah County, percent. So the first row shows the percentage of uninsured people between 18 and 64 in the year 2009. In Multnomah County, it was 21.7. In King County, Washington, it was 15.2. San Francisco, 16.4. So ours, once again, seems to be substantially different from our counterparts. The percentage of people who are uninsured, percentage of people who are 19 years and under and uninsured, in Portland, Multnomah County, it's 10%. In Seattle, a little more than, well, it's 5.8%, and in San Francisco, 7.6%. And when we look at diabetes rates, again, this time in 2008, in Multnomah County, it's 7.3%, in Seattle, 6.6%, and in San Francisco, 7.7%. We look at there's disparities across different populations: American Indian and Alaska Native, Asian, Black, Hispano Latino, Native Pacific Islander, and white. And the first one, of course, just shows the population in the city of how these different groups are represented. So in Portland, and these are all information for Portland. So in Portland, our highest percentage of any one group, of course, would be of whites, almost 90%. The next biggest group is of Latinos, then Asians, then Blacks, then African Americans, and Pacific Islander people come in the last group. But when we look at unemployment rates for people between 16 and 64, which would be the second row, look at the numbers and how they compare. For American Indian and Alaska Natives, it's 19.6. For African Americans and Blacks, 17.5. For Hispano Latino, 14.7. And for whites, 11.9. Now, none of these numbers are attractive for any group. Everybody is having a very difficult time. These are really high rates. But you can see how some groups suffer more than others. When we look at children in poverty, the third row, for those groups that we have information for, as much as 26% of kids in poverty in the African American community, as much as 26% of their kids are in poverty. For Hispanic and the Latino people, almost about the same amount, 25.88. Compared to Asians and whites, you can see there is a significant difference. When we look at household spending, 30% or more of their income on housing, that would be the fourth row. For Asian populations, it's 38.4%. For Hispanic and Latino people, half of their income goes on housing. For whites, it's 34.9, almost 35%. But look at the number for African Americans, 54%. And the data, if you continue looking at it, it maintains that same pattern of inequity. This is information about inequities in education, and we look at them in terms of high school graduation rates, third graders who did not meet reading assessments. We also look at the number of live births, we look at obesity, we look at infant mortality rates, and the pattern is consistent. The pattern remains the same. Now, at Portland State, being an institution in the midst of an urban environment, you can well understand that that would be some of the sort of potential areas of research as we, as academics and students and community partners, trying to figure out what our calling is and how we can make our city better. The mission of the university itself is let knowledge serve the city, and when you actually read more closely how we have it stated, it's for us to be known for our community-engaged research that contributes to the economic vitality, environmental sustainability, and quality of life in the region, the Portland region, and beyond. We also want to promote a reciprocal relationship between the community and the university, in which knowledge serves the city and the city contributes to the knowledge of the university. So at heart of the institution is a fundamental understanding that the work we do in the institution needs to reflect the issues that are faced by the populations of people we live with, and we go to school with, and we share our lives with. So there's that very intimate understanding of what we're about and what we're trying to do. So this group of faculty and students and community partners, and I want to insist for you, every time I talk about the partnership, it's across that academic institution and our community. We have attempted to build a partnership, especially around health equity, with a number of initiatives that we've been working on. The Social Sustainability Colloquium, we first developed around 2004, and the idea was to bring together community partners and people who had interest in social sustainability, something of a learning lab, so we could exchange ideas, what we were doing, what we were interested in, what the community wanted to see done, what were the frustrations, and potentially what areas we could actually find common ground and work on in terms of research. After that, we developed a very strong social sustainability network, where people would regularly get together, develop research collaborations, talk to community partners. Community partners would tell us about the work they were doing, share the work they were doing, things that were working, things that were frustrating. We also had the Social Sustainability Planning Group, and then the Search for Social Sustainable Solutions and building a community-based partnership is where we actually are right now. And I'm being told I have 1 more minute, so I clearly have used far more time than I should have. This is the Social Sustainability Colloquium that I mentioned as a living laboratory that we had worked on. We had a network planning grant where we established the empirical basis for long-term collaborative research and practice. So what we wanted to do was not just a one-time exchange of research ideas, but we wanted to start to build a foundation for data collection, the definition of research questions together with our community partners in a long-term relationship, a long-term iterative relationship. So as we figured out what was not working, we would work along lines of advocacy from our different positions towards solving the problem. But Of course, there were lots of organizations, some of our community partners that had already done this work, so we relied on the reports that had been done. For example, the Regional Equity Atlas, the Coalition for a Livable Future had already produced, the State of Black Oregon from the Urban League, the Communities of Color in Multnomah County that had been produced by the Coalition of Communities of Color. We also looked closely at the voices from the community, the Vision PDX Input Report that had been produced by Vision into Action Coalition. And the major findings were not a surprise, but we did get data that proved conclusively some of the things that were happening is that we had a lot of social exclusion taking place. People who could not take advantage of the opportunities that were available to some. So we ended up with people actually being excluded from being able to take advantage and to be able to participate in the community as other people were. And what were these areas of disadvantage or these areas of exclusion? Health and well-being, housing, green spaces, education, employment, transportation, public safety, and the justice system. And what we did with the reports, we essentially looked at them, figured out what the common themes were, then we brought together focus groups and said, this is the work that you had produced in the reports, what was missing, what were the frustrations, where would we take it next? So we had a focus group to do that. And we ended up recognizing and building on the strengths of the community members in terms of working on problems identified by the community, using a co-learning approach, and using workshops and classes in the community to get us to that point. So I talked about the projects we had been engaged in. One of them was the Sustainable Solutions Project, where we attempted to understand the sources of inequity and what community partners were actually doing. So we relied on what they were telling us to figure out what the challenges were and the strategies that were being used to respond to the challenges they were facing. Now, when we talk about social sustainability, and I think I mentioned it in the beginning part of my remarks, what we really refer to are the institutions and processes that generate social health and well-being now and in the future. So we are very much focused on what kinds of rules, laws, regulations, practices, institutions, and more importantly, the avenues for people to participate to actually bring about the changes in these institutions to have improved social outcomes. And we also focus, when we talk about social sustainability, on the social, political, and economic institutions and processes that facilitate environmental sustainability now and in the future. And that definition was developed from the social sustainability colloquium exchanges, out of which we actually had a publication that reflected the work of people at PSU as well as people in the community. We've also actively been talking about social determinants of health, because social determinants of health, as some of you, particularly in public health, would know, refers to the conditions in which people are born, grow, live, work, and age, because these are the upfront factors that reflect what outcomes you will get. So when we talk about improved well-being, more socially sustainable communities, we have to pay attention to these input factors that affect the eventual health outcomes that we have. And we also talk a lot about health equity, and the health which we're defining as the absence of systematic disparities in health between groups with different levels of underlying social disadvantage or advantage. And when we talk about social disadvantage or advantages, we're referring to wealth, power, or prestige. What we know in terms of the work as we proceed, we know if we leave these disparities and these inequities unattended, or we don't pay attention to the designs we use as we go into the future, we ignore unequal access to resources, and that inevitably will have adverse consequences and undermine well-being, not just now as we see it evident, but for generations to come, and that's what is particularly preoccupying. And I hand over to Eileen.
Thanks, Veronica, for really setting the scene here for what we found. And Veronica just mentioned that we had focus groups and interviews, and I want to say on behalf of my colleagues that they were a humbling experience, that we were rocked back on our heels by what we were hearing from the community. The community is excited when the university gets involved in research, but they also wanted action. They wanted change. They wanted things to be different, and they let us know it. And the polite focus group turned into a heated discussion about what was going on in Portland and the solutions that people had put in place and the barriers that they faced. And so we wound up with 4 themes which we have written up to try to capture what we heard in those focus groups and interviews. First of all, the first theme we heard, let's see here, was, let me go back, it will not, there we go. The first theme was about the problems that they faced in the community-based organizations. And basically what they said is those social impacts of those statistics that Veronica went through, that those are experienced every day by marginalized or disadvantaged groups. And that's what they were seeing, the results of those kinds of social determinants. And those problems are not easily solved because they're interlinked. So you have low-income possibilities. You have not access to jobs. You can't get to the jobs because the transportation systems aren't working for you. The housing is inadequate, or you become homeless. And poverty is there, and low levels of education, differential levels of education. So it all was wound up. And so the people that were working on environmental health and other kinds of health issues were seeing that the health was just one part of this ball of yarn that was all twisted together. And they would get something fixed at one side and it would pull the ball of yarn and distort it in another direction. The second thing, we wanted to hear about solutions. We were funded at that point to try to find out what solutions were going on in the community. And in fact, what we found out was that when they were successful in doing more than just patching up people who were ill, they were getting people in the community involved in organizations. They were working with the leaders in the community to develop other leaders. So it was kind of like a snowballing of leadership and empowerment and building a sense of community. One community partner said there was a leadership program with task forces including a civil rights work group, a housing work group, and a health work group. And that community worker saw that those were all intertwined. And the solutions can't be generated simply by outside parties. They have to actively involve and be shaped by those in need. And almost to a person out of the 11 people that we interviewed, they embraced leadership, empowerment, and community as the key components in any kind of solution. Of course, they talked about structural barriers. And as we've seen just from the statistics, there's inadequate opportunity to access financial resources. There's a lack of living wage jobs, the incomes are lower for some groups than others, and government resources aren't there. The health care isn't there for everybody the same way. The educational system doesn't serve everybody to the same level. And unlike, it isn't on this slide, but one of the things that became clear is there was a feeling among this group of people that racism had a lot to do with it in Portland. And also there was an absence of explicit legislation and policies that address structural barriers. One community partner said, there are federal and state and local funding decisions that result in not enough money for service and operations needed to serve low-income communities, and all the money in the world to build a new fancy light rail or streetcar or whatever, which really just continues to benefit the same kind of contractors, the same developers, and the same businesses. So that was a very hard saying, but one that rang very true to the other participants in the study. The recommended solutions that they suggested were addressing the current barriers faced by Portland organizations through community empowerment, education, collaboration, and policy legislation, and basically raising up a new round of leaders who would, in fact, take care of these structural issues. So what we could conclude from this is many Portland organizations invest energies into the management of symptoms of larger systemic issues, that is racism and poverty, but they lack the resources and leadership to tackle the systemic issues. So basically they're working downstream and they're sick of it. They were tired of it and they gave us a lot of pushback. And basically they asked, what are you going to do about it at the university? Are you going to just come in like a helicopter, get your data, and then pull out again? And there was not very much sympathy with that kind of an approach. Basically, they were asking us to be in it for the long haul, to develop the relationships. The frustration was very apparent, and the energy and focus to create and develop solutions was there. So people were willing to work on those with whatever we could bring from the university. So the next step was to do community-based participatory research projects. So CBPR is the name of the approach, and it is an approach which asks people with research skills to work on building partnerships and to develop new projects, service plans, research with community groups that actually are going to work in the community and that are wanted by the community. So that is another major piece. You also have to move forward, they said, to address inequities created by the unequal exposure to stressors in the built and natural environment, as we saw in the 4 reports that we looked at. So what to do with this? Well, bring partners in and go out to partners, go out in the community. So we had meetings with key organizational leaders. Faculty went out to organizational leaders and saw what kinds of things were important to them. We brought our students out, so the next generation of people in Portland would be on the front lines as problems started to get solved. And we had research team meetings to identify possible sources of funding, because we didn't want to come empty-handed. We wanted to come with resources. So it wouldn't just be ideas, but it would be resources that could be brought into the community, where we could gather communities' resources and use them together. And we wanted to link PSU, OHSU, and community organizations. So then we've had a series of partnership meetings which have been focused on building relationships between the community partners, faculty, and students. And we decided on research needed for the community and operating principles. So one thing that was interesting about the meetings is we were really focused on what's our research focus. And the first meeting was the partners are, how are we going to work together? It wasn't what's going to be the research focus, what grant are we going to go after? It was, tell us what our role, you see our role, and we'll tell you what we think our role should be. And this is how we should treat each other. And that was really a good thing for researchers to hear. The other thing was that people were interested in other aspects other than just research. And fortunately today we have Marion Sharp with us, who's part of the continuing education department at Portland State, who's been talking with people about other alternative pathways into the university, where the university can not only be a research source, but also can be a source of education where people from the university are in the community, learning from community members, and there's the possibility for community members to come in and co-lead, co-teach, co-learn with us as well. And Marion, I hope maybe during the question and answer you'll talk more about this. So today we've asked 3 of our partners to provide their perspectives on what the community actually needs from these university community collaborations, and what are the challenges that they see that they face in collaborating, and how we can keep moving forward. So I would like to welcome Leroy Patton, who's been a wonderful advisor through the last 3 years with our project, to talk about his perspectives.
Let me say first that I was a little reluctant to do this. Can you hear me? Is this thing? I was reluctant to do this because, not having research, I felt like I was out of place and that nobody would listen to me. But if they listened, it didn't matter. So in reviewing what I was going to say, it occurred to me that I need to remind everybody here that as a community partner, I'm speaking to your subconscious. And the reason I'm speaking to your subconscious is because whatever people hear, it's what they think about and what they do that matters. So I'm not concerned about being heard, I'm concerned about action and what you're willing to do in an action way. So open your subconscious or bring it up. And I guess I'll just say that parenthetically, I'm an advisor to this grant committee. And as an advisor, I'm only concerned about establishing a growth, fostering relationship with the committee and with the community, so that everybody's clear what I'm doing here and I'm clear about what I'm doing here. I want to remind everybody that developing a community partnership will be a challenge as far as I'm concerned. And the challenge is that first, we must understand our own relationships and experiences. People don't usually realize what they're doing every day, they just do it. So the challenge is going to be to come to grips with your own day-to-day living, become familiar with what that is, and then put it on the table with what the change you're expecting to either involve yourself in or to make. And to do that, that's a comparison action that you have to take part in. That's not something your boss said you had to do or the university said you had to do or you have to pass a test to do. It's a day-to-day contact. We don't deal with that very much. We deal with our habits that we have all the time. So as a process and as a challenge, we have to identify the emerging experiences that are going to work for us when we're talking to somebody else. And it's usually somebody you don't know. You may know their name, but you don't know who they are. You don't know how they live. You don't know how you can compare their life to your life, or vice versa. People experience change in their relationship through the impact of their influences. The people around you influence what you do, and you influence what they do. The people we're asking you to partner with, you don't have a clue what they're like, what that relationship's going to be, and how you're going to work in it. So that's a real impact, and it's going to be difficult for the community to come to grips with the kinds of things that they've already witnessed and not been very happy with. And let me remind everybody that part of that experience is being told for millennia or for forever that research and resources are going to be put into the community for the needy and the people that need it. And as they do that, they're going to have a better life. And in most cases, that never happened. And when somebody had the guts to confront an official, an administrator, or someone responsible why it didn't happen, there were all kinds of excuses and reasons. But it still didn't happen. Now we're talking about building a partnership with the community. My fear is the community's already pushed back and said, how many times are you going to slap me in the face? And they're not going to, well, they may say okay, but they're not going to be willing to do very much. And we can't be successful if the pushback's from the community that we're trying to form partnerships with. So I'm really concerned about where people are in their head when they think about cooperating. And I guess what affects me most is we're dealing now with another generation. The people that are going into the community and coming out of college and going to college, they're a different generation than their parents and the people older than them, like me. So they may be very willing to cooperate, to build these partnerships, and they don't have any idea about the history. So when the community pushes back, the history's pushing them back. A parent says, I don't know why you want to cooperate with them, they're not going to do anything. As a school administrator, I heard that I don't know how many times. You want to get your kid back to school. For what? They ain't going to do nothing anyway. Well, he needs a degree. For what? They're not going to hire him. This was rampant. This wasn't an isolated case. And it's still the case the way we treat people in our minority communities. They don't know if they're welcome anywhere. And now we're talking about forming partnerships. So my personal concern is that we prepare our mind to change how we interact, how we are able to do that. There are solutions to that, but you have to be ready to put the recipe together and make it work. So I'm concerned about where the new generation is coming from to integrate the partnership to make things work. So one of the things I did look up was things that we need to do to be sensitive is to remember the fear of mistreatment that the community already has. You don't have anything to do with that. It's already been put there. And so the activities that we suggest must reflect goodwill. Can't just be some words. You say, I'm going to feed you, somebody better be out there with a truck or something to give you something that's only a bottle of pop. Because that reflection is what they're looking for. What are you going to do? And they're not going to ask you anything. And then I'm concerned about our language that we use to build those relationships. I'm reminded that in our culture, racism and sexism are kind of ideologies that permeate everything we do. And more often than not are seen as natural, normal, and inevitable. So if somebody does something against a woman or a minority, so what's the problem? That's always been the case. Nothing new. It might be new to the person it happened to, but that's the only person it's new to. Everybody else, well, you know how they feel about them or whatever. I'm reminded that our culture, in looking at racism and sexism, we also live by the myth of meritocracy. Now, that was a new word in my vocabulary when I got in the school district. I didn't really know what that meant. I thought I knew what it meant. But when you talk about meritocracy, you're talking about those people who are successful. And who are they? They're the people that get to college, have good grades, graduate, get the honors, and go on and get all of the upper level benefits. They did all the right things. And then what about all those people who didn't make it in that manner? What do they say about them? Well, they didn't have the right stuff. They didn't know how. With no excuses or reasons for that response. It's just that they weren't designated, delegated, anointed, or looked at or perceived as being able to do anything. So it's their fault. It doesn't matter how many people pushed them down, kicked them, didn't give them an opportunity. It was still their fault. We still live by that. You ask somebody why somebody didn't make it, well, he probably didn't do the right things. They say that without knowing the person. I'm not talking about knowing what somebody did and then saying, well, he didn't do this, this, and this. They're just taking the whole thing collectively in a general way and saying, well, if he didn't make it, he probably didn't pass all the tests, do all the right things, which is not true. I just want to remind people that's still how we treat our populations, all of our population. And that kind of expectation puts us on the map for not being believed in terms of forming partnerships and developing relationships. So we've got a big job to do, and I just want everybody to know it's going to be a challenge, and it's going to be in your heart and in your head.
Thank you, Leroy, and welcome, everyone. Good afternoon. My name is Noel Wiggins, and as my coworkers have said, I have the pleasure and honor of managing the Community Capacitation Center, which is a program of the Multnomah County Health Department. And when we're pressed to describe briefly what we do at the Capacitation Center, because it's not easy, we say that our mission is to support communities to identify and solve their own most pressing health issues by addressing the underlying social and structural causes of those issues. So you can probably already begin to see why this partnership was of interest to me. And one of the things that my colleagues asked me to do this afternoon is talk about why did I choose to join this partnership. So I think I'll focus on that. I think one of the reasons that when my colleagues Eileen and Veronica and others invited me to join the partnership, they told me some of the key models that they were considering using in their work. And those were some of the models that I feel the most committed to and that I have seen to be the most effective in about 25 years of public health work in a variety of places around the country and around the world. And those models are, first of all, popular education. And when I say popular education, I of course can't talk about popular education without doing a bit of it. So I'm curious, when I mention the phrase popular education, what comes to your mind? And this is a brainstorm, so there are no wrong answers. When you hear popular, yes?
Role playing.
Role playing, great. What else comes to your mind when you hear popular education? Rachel?
All people are involved.
All people are involved, excellent. Role playing, all people are involved. Anything else come to your mind? Yes?
Culturally competent.
Culturally competent and respecting people's cultures, absolutely, thank you. Yes, right over here.
Informal education.
Informal education, great.
Fun.
Fun, yes, thank you. One more out there somewhere? That's great. Oh, wait, I think I did hear.
Experiential education.
Experiential education, thank you very much. So you've just proved the principle of popular education that in any group they already know a great deal about whatever topic you're discussing, because everything you've just said are important aspects of popular education. Just to summarize a little bit what you've said, popular education is a philosophy and a methodology that's used for education and organizing in many parts of the world that creates settings where people most affected by inequities and issues can discover their own wisdom and capacity and pool it together to identify and solve problems in their own communities. And it has roots, as I mentioned, in many parts of the world. The roots that I happen to know best are the roots in Latin America. It also has roots in the southeastern United States at a place called the Highlander Research and Education Center. So first of all, my colleagues were talking about popular education, so that drew me in. Secondly, they were talking about something called the community health worker model, which Lila has already referred to this afternoon. So I'm going to ask you again, when you hear community health workers, what comes to your mind? Yes, I saw a hand right over here.
Somebody who's like embedded within the community and has connections with people and it has trust.
Exactly. Somebody who's embedded within the community, has connections, and has trust. Beautiful. I heard another voice.
Gatekeeper.
Gatekeepers, great. What else? When you hear popular, yes, right over here.
Nurses, doctors,
Okay.
within the community.
Yeah, and that's a really good point. We can think about community health workers generally as including everyone who does community health work, or we can also think of community health workers as a specific group within that larger group. And Rachel, I wonder if you were going to say something about that.
Educators.
Educators, absolutely. Thank you. So when I am using the term community health workers, I am actually speaking about a smaller subset of that larger group. And I'm talking about people who are trusted community members who participate in training so that they can promote health in their own community. And again, this is a model that's been used widely around the world, and I've had the opportunity to be involved in community health worker programs in rural El Salvador in the late 1980s, in rural Oregon in the early 1990s, in Boston in the mid-1990s, and then in Portland since about 1998, and have seen the model work brilliantly in all of those settings. So when they mentioned community health workers, that was another factor that drew me in. And finally, as we've already discussed, they were talking about using community-based participatory research, which my coworkers and I often think of as the research application of popular education. And as my coworkers have said, and I'll just underline it, is really about involving the people most affected by inequities in every step of the research process, from the identification of the research questions to the dissemination of the findings. And I think, as you can probably hear already, these models have a considerable amount in common, right? What are some of the commonalities that you're hearing between community health workers, popular education, and CVPR? Back here?
They're all very empowering.
They're all very empowering, yes. Done correctly, they should absolutely increase empowerment. Way back in the back.
It respects the knowledge that's already in the community.
It respects the knowledge already in the community, right over here.
The people who are really doing the work are in the community themselves.
The people who are doing the work are in the community themselves, exactly. Thank you, and I saw a hand right over here.
Building capacity in the community.
Building capacity that's going to stay in the communities. Yes, and it's sustainable, yeah, absolutely. Right over here?
Creating stakeholders among the research.
Absolutely. Say a little bit more about that.
They're personally invested in the researcher, so in the research, so as they're becoming stakeholders, they also want the research to progress.
Absolutely. It builds crucial buy-in and support for the research process because we're all part of it. And finally, right back here.
That it gives a platform for voices to be heard finally?
Absolutely, and it gives a platform for voices to be heard. So, I mean, you all have said it much better than I could. All these models have similar historical underpinnings. Many of them have roots in the political and social ferment that occurred in Latin America and throughout the global south in the mid-20th century. And they also have a number of philosophical similarities, such as some of the ideas you've already mentioned, that people most affected by an issue really are the experts on that issue, and therefore they're uniquely placed to identify solutions and implement those solutions. I want to close up here so that my colleague Ben has adequate time for his presentation. So I'll just close by saying that the other reason I was attracted to this partnership is that I've been involved in some community university partnerships for a number of years and have just felt the power of those to really encourage learning all across that spectrum, because I think another thing that's coming through here today is that it's not researchers on one side and community on the other, but it really is a spectrum of people who are involved in the process. Everyone becomes a researcher. Everyone learns from the process. Just in closing, I think we see our role at the Community Capacitation Center really as being a bridge along that continuum to work with both university-based researchers and a variety of community groups and community members to really promote the learning and the action that can happen uniquely when people all along the spectrum are working together. So I'll close there. Thanks very much.
Got my slide here. So I was actually thinking that, Noel, you were going to do a Dynamica. Started talking about popular education.
I was really tempted.
Yeah. So I'm Ben Duncan. You kind of see the kind of multiple hats. And like Noel, I'll talk about really kind of what brought me to this table. And, certainly, you know, for those of you that saw me earlier in the agenda of bed bugs, that's not kind of my passion that brought me to public health. And really, this is kind of more of the work that around environmental justice and social change that really brought me into this work. And you know, I don't have a public health background. I wouldn't call myself an academic, but I'm fascinated by these kind of partnerships. And you know, so when I come to this work, you know, I came around this table, you know, as representing OPAL, organizing people, activating leaders, opalpdx.org. There's a donate button for those of you that have disposable income. But also as a public health professional, because there's such incredible links between the work that OPAL's doing and organizing and working in low-income communities of color and the outcomes that we see in public health. So, you know, I think, you know, part of it is, you know, also that, you know, if you kind of wrote me in, you say, you know, we're going to work on environmental justice and social change, it's like, all right, I'll come to that meeting. And that's kind of how I originally kind of came here, you know, having these kind of discussions around these issues. But for environmental justice organizations in particular, I mean, there's such a deficiency of resources, and historically, EJ organizations have not been at these tables. You know, it's kind of like Eileen said, you know, it was traditionally, you know, academia comes in the helicopter approach and lands in the middle of these low-income communities of color and does their research, collects the data, and gets out of there. So for me, it was, you know, this approach and the language that we've heard already, was so critical, and it was such a great opportunity to be able to sit at the table and think that, hopefully we can influence the process. Another thing I'll say, I will also just back up a little bit, from my background and coming into this work, Leroy's been kind of speaking to my subconscious, since I started in public health, about 8 years ago. And so I think it was really poignant. I just want to say that it's a critical piece to have the mentors like you in the communities, speaking on behalf. And for those of us who haven't been at these tables for so long. But what was really exciting is this idea that there's such a need for these partnerships that are meaningful and that support community identified need. Rather than this kind of alternative option where academics kind of have their specialized research and they find the community that fits within it. But really finding, getting the community together, finding what those identified needs are, and allowing that to drive the agenda, allowing that to determine what grants you actually go after, and really defining and pushing that research agenda. And what's so great about it, I think that one, it's important just as a method of process, but it makes the research more valuable. And I think both from the academic perspective and the community perspective. And I'll talk about, as I close, around some of the challenges of that. Another thing that brought me, to this work is around, this idea of what the public health workforce looks at. And again, with this bridge between the work that Opal does and the work in public health and Noel's work around community health workers, when she asked that question, I didn't hear anybody say community organizing. And so when I think about the public health workforce, in a lot of ways, I think about the staff of Opal and the folks that are going out and trying to mobilize and build capacity in these communities that aren't typically thought of as public health employees, but really trying to expand. Can environmental justice organizations like Opal sit around when we're looking at kind of health-based research and really expand our role to say, some of these dollars need to come to this type of work, to hire people, as Leroy would always say, in the community, that have those relationships, that have the skill sets around community organizing. And I think in a lot of ways it's very parallel to what community health workers do. There's old EJ adage, the communities that speak for themselves best protect themselves. And a lot of times environmental justice is about fighting against kind of the oppression of pollution and other kind of factors that negatively impact people. And I think about this, that in the broader scope of addressing health inequities, that empowered communities can best eliminate those health inequities. We have to put the research that supports and hire folks that can go in and do the work that's going to mobilize communities in a positive way to create change. I also think, what's exciting about this is that in academia, there's principles around EJ, and that this process felt like it was academia trying to be consistent with some of those principles, and most namely being meaningful involvement. So what I really felt, in a positive way, and I enter into this work with a kind of balance between cynicism and hope, is that when we come to the table, I really felt there was meaningful involvement. I really felt like, maybe I was in those focus groups, and I was probably one of those folks kind of barking and pushing back on what are you guys even doing? Coming in with that attitude. But as the process evolved, I really felt like there was a space for this meaningful input. That the ability of the voice, and I, speaking on behalf of an organization, I wouldn't pretend to speak on behalf of the communities that are impacted. But the ability to actually influence the process, the ability to influence the academic agenda. And so I think, this is a great start. And I'd like to see, as this type of work continues, that we increase, those actual impacted community members coming to these tables and having that same kind of level of access and influence that, I think those of us that were community partners were able to have. Certainly, as I said, I'm not an academic, and I've been enough in these settings to really think about how we continue to do this work, and shifting kind of the processes and the language, as Leroy talked about, and dealing with kind of these institutional pressures, everything from publication to peer review to research dollars. I mean, there's a tremendous, in research institutions, there's tremendous pressure for tenure, right? And there's a tremendous pressure to bring in dollars, to have peer-reviewed, focused research. And there's maybe it's growing, but there's still a pushback around CVPR as a methodology, as a legitimate research, a legitimate way of doing research. And so I hope that part of what these conversations have is the ability to identify the value of this research, the ability for that young PhD that's starting down their pathway to be able to challenge the status quo, to be able to challenge the institution and be supported. And how do we do that? And I think that's one of the questions I pose for this group. I think I pose it for Portland State, is if we value this type of work, if we value the meaningful participation of communities to drive the agendas of research institutions, then how do we actually support folks that are going to do that? Or do you have to be in the field for 20 years, get enough publication, get your tenure, and then you can start running your mouth and doing things that actually challenge the status quo? And so so what I hope is that this is a starting point in that conversation where we can really start shifting the way academia partners with communities, how professors and academics kind of see their work, especially those that see their research with an advocacy purpose and with a social change purpose, because there's so much potential. And there's so many wonderful people that get it, that just need to be able to support from those institutions. And then I think the final piece, we all approach this work kind of with the intent to make the outcomes, whether it's health disparities or educational achievement, more equitable. And so it's really, I have a great deal of pride in being able to have these kind of dialogues, and I really appreciate the space. So I'll leave it at that, and thanks.
Thank you very much. We have a few more minutes if there are questions. And am I moderating? I'm assuming. Ben? You and I are moderating. So that means I take the hands and you take the questions. If we're living in a world where we're already talking about making education far more relevant to the societies in which we live, there is a lot of inertia in academic institutions. And there is inertia because it's, in a way, a sort of a guild system. You go through your apprenticeship, and then you become legitimate, and you can do other work. But at an institution like Portland State, where we actually have let knowledge serve the city, there is some evidence in terms of our interest in interdisciplinary research, the way we have designed our capstones to integrate it into the undergraduate curriculum in particular. Some of our PhD programs and the classes that we offer tend to be more problem-based research approaches, especially when we do integrated research. So there is some evidence that there is interest in going into that more socially responsible route, but it takes a long time. So my recommendation would be to find faculty who have an affinity, and who might help you balance your passion for doing that kind of relevant community problem-based work and figuring out how to maneuver and work within the tradition of academia as well. Ben and Noel.
Yeah, it's a great question you're asking, and I think, I would point out too that there's hugely varying degrees of support for community-based participatory research, both depending on the institution, as Veronica has already pointed out, and also depending on the discipline. And I'll say that, I think public health has been a real leader in their openness to community-based participatory research. Social work is certainly coming along, and I congratulate my social work colleagues. As somebody who has my doctorate in education, I would like to see a lot more progress within academics and education in their openness to community-based participatory research, because I'll tell you at the moment it's sorely lacking. And then also looking at different institutions, as Veronica is pointing out, Portland State is building their support. There are other universities around the country, the University of North Carolina at Chapel Hill, the University of Michigan, that have actually changed their tenure and promotion processes within the university to give more weight to community-based participatory research. So there are good precedents for universities to look at and for tenure and promotion committees to look at, and there's a lot more work to be done.
Of course.
And I'd just like to also add, I think that there is substantial evidence that this is better research, that you're actually responding to what people need and want. And so interventions, when you do them, are going to work better because they will come out of the community, they will be part of the community. And as you pointed out, Ben, they in fact have legs in the community because people are in fact part of the intervention. They designed it. They own it.
Right. Ben, did you want to add any comments?
Well, just when I hear p-value, and that's, it's, I mean, so it's not just like the way you structure your research, but it's how it's presented. And so the other thing, so when you're looking at p-values, like your average community member, including myself, who I think I failed statistics and got a D the other time I took it. So, it's like, what the hell does this mean? I mean, it doesn't mean anything to someone. But also, when we combine kind of the language of academia with the access to academic research, I mean, it's like you have to have, the search engine, or you have to have the access to the journal. So even like, we don't even have open access to the research that's happening. So even when it's not done in a partnership-based way, it lives here. It lives for the researcher, it lives for the academic, rather than for the community benefit.
Yeah, I mean, I think my experience in both El Salvador and here, and we're doing more and more prevention of violence affecting youth in my program right now, is that when young people are members of communities that have experienced systematic oppression, they will get to a certain age and they'll want to take action about that. And in some settings, there'll be an organized movement that they can join, a non-violent movement that they can join and be a part of making change. And when those non-violent options aren't there, sometimes they'll choose other options. And I'm not saying that's a good choice, I'm just saying that it is sometimes not an illogical choice given the situation in which young people find themselves. And so I think the important point is to create non-violent options so that young people and older people can be involved in making systematic change that really gets at those underlying causes. I'll stop there.
But the other thing to think about, we talk about social determinants of health and problems about poverty and gang violence and what people end up doing, young people in particular who seem to be very vulnerable, have to do with structural disparities. I mean, if we could have taken care of some of these issues on the front end, we wouldn't have them on the bottom end. And we need to remember to make these connections, because especially with some of our community partners, the frustration is increasingly they realize some of the work that they're involved in cannot be solved conclusively without addressing the larger structural issues. And that's where there's more potential for collaboration, not just for dealing with these problems, but for, in a sense, mobilizing and building coalitions to actually, as Ben suggests, have voice, to speak on your community's own behalf about what you want to see it look like.